Good morning, everyone. I'm Dave of Stage 5 Kidney Failure. Welcome to my kidney journey. Today's topic is Category 4 dialysis, hemodialysis, Part 18 of 35, First-Year Syndrome. First-Year Syndrome is an acute hypertensivity reaction that occurs shortly after starting our hemodialysis. Most commonly when a patient's blood is first exposed to a new dialyzer membrane or residual manufacturing sterilization agents. Types of first-year syndrome: Type A, anaphylactic hypertensivity reaction. Timing onset typically occurs within the first 1 to 5 minutes of starting treatment, rarely up to 30 minutes. Severity: severe and potentially life-threatening. Symptoms: difficulty breathing, wheezing, hives, burning sensation at the access site or throughout the body, sudden hypertension, low blood pressure, and severe abdominal cramps. Primary triggers: residues of ethylene oxide gas used to sterilize new dialyzers or interactions with specific membrane materials, particularly in individuals taking ACE inhibitors. Type B, non-specific biocompatibility reaction. Timing onset occurs within 15 to 30 minutes or up to 1 to 2 hours into the session. Severity: milder and much more common than Type A. Symptoms often gradually diminish over subsequent treatments as the dialyzer becomes coated with host proteins. Symptoms: mild to moderate back pain, chest pain, nausea, and general fatigue and malaise. Primary triggers: complement systems activation caused by blood interaction with less biocompatible membrane surfaces, for example, unsubstituted reprocessed cellulose. Management and prevention: immediate intervention. Type A, dialysis is halted immediately and the blood in the circuit is discarded rather than returned to avoid introducing more allergens into circulation. Emergency treatments such as oxygen antihistamines are administered. Dialyzer pre-rinsing. Rinsing dialyzers thoroughly with saline prior to setup helps wash away leftover sterilization chemicals like ethylene oxide. Alternative sterilization: utilizing dialyzers sterilized with gamma radiation or steam instead of chemical reactions. Biocompatible membranes: switching to modern synthetic membranes significantly reduces complement activation and allergic responses. Management and prevention for Type B first-year syndrome focuses on minimizing complement activation and dampening the blood non-specific inflammatory reaction to the dialyzer membrane. Unlike Type A reaction, Type B symptoms are milder, non-anaphylactic, and generally self-limiting. Continue dialysis. Treatment does not usually need to be stopped. The blood inside the circuit is kept in place and dialysis proceeds as planned. Systematic relief: provide targeted support care based on specific complaints. Oxygen therapy: supplement low-flow oxygen for mild chest discomfort, mild pain relievers for persistent back or muscle pain. Reassurance and monitoring: continuously monitor vital signs and oxygen saturation to confirm the reaction remains mild and does not evolve into Type A response. Gradual resolution: symptoms typically peak within 30 to 60 minutes and gradually diminish over the remainder of the session as circulating plasma proteins coat the membrane surface. Prevention strategies for future sessions: prevention revolves around improving biocompatibility and altering how the body interacts with the dialyzer. Switch membrane materials: transition from older cellulose-based membranes which trigger high complement activation and to synthetic, highly biocompatible membranes. Thorough saline pre-rinsing: prime and rinse the dialyzer with a generous volume of normal saline before connecting the patient to flush out lingering and manufacturing debris or chemicals. Dialyzer reuse: reprocessing: Where reuse protocols are practiced, reprocessing dialyzers can often cause fewer type B reactions because residual host proteins from the first session form a protective layer over the membrane. Alternative sterilization. Select dialyzers sterilized using gamma radiation or steam rather than chemical agents like ethylene oxide. Anyone watching this vlog, if you currently receive dialysis, think back to when you started dialysis. Ask yourself if you suffered from first use syndrome. Also ask your nurses if they've had patients that have had first use syndrome. What you'll find is a lot of long-term staff are going to be the only ones who know about these types of conditions. Dialysis staff are also going to notice you're being very proactive in arming yourself with knowledge about chronic kidney disease, and that's definitely a good thing. That's today's topic completed. Thank you for watching. If you like the content I'm providing, please hit like, follow, share, and subscribe. Helps get my story out there. It's Wednesday morning. I hope everyone has a great day. Be safe. I'll see you all again tomorrow. Goodbye.